This is hip bone. It has three parts: ilium, ischium, and pubis. The thick posterior-inferior part is ischium. It has body and ramus. This is the body and this is the ramus. Body has upper and lower end. And now three border: anterior border, posterior border, and this is the lateral border. And three surface: femoral surface, dorsal surface, and pelvic surface. Now the upper end of the body of the ischium fused with the ilium and pubis to form acetabulum. So the upper end form posterior inferior 2/5 of the acetabulum, this portion. The lower end is thick and comma shaped, and this is called the ischial tuberosity. Here a horizontal line which divided it into upper and lower portion, and in the upper portion there is a oblique ridge by which it is divided again into two surfaces, supralateral and inframedial. Supralateral surface gives origin to the semimembranous muscle, and inframedial surface gives origin to the long head of biceps femoris and semitendinosus muscle. And in the lower portion there is a vertical ridge by which it is divided into medial and lateral surface. Medial surface is covered by the fibrofatty tissue, and the function is weight transmission from the hip bone to the surface in sitting position. And in the lateral surface there is a origin of ischial head of adductor magnus muscle. Now the medial margin of ischial tuberosity is rough. Here the attachment is sacrotuberous ligament. The attachment of anterior border is obturator membrane, and this is the anterior border. And tip of the ischial spine, here the attachment is sacrospinous ligament, and this sacrospinous ligament converted the greater sciatic notch into the greater sciatic foramen. Now in the pelvic surface of ischial spine, here the attachment is coccygeus and levator ani muscle, and these two muscles togetherly form pelvic diaphragm. Upper end and lower margin of laser sciatic notch, here the attachment is the origin of gemellus superior and inferior respectively. Now the dorsal surface of ischial spine, here the lateral to medial attachment is pudental nerve, internal pudental vessel, and nerve to obturator internus. These three structures coming out from greater sciatic foramen and pudental nerve and internal pudental vessel enters through the laser sciatic foramen along the pudental canal, and nerve to obturator internus ends by supplying the obturator internus muscle. The lateral border forming the lateral margin of ischial tuberosity. This notch is lodged by tendon of obturator internus is in living body, then attached to the greater trochanter of femur finally. Now come to the femoral surface. It is situated in between the anterior border and lateral border, and then continuous with the outer surface of conjoint ischiopubic ramus. And this is the conjoint ischiopubic ramus. Close to the obturator foramen, from here the obturator externus muscle is originated, and close to the lateral border, from here quadratus femoris muscle is originated. Pelvic surface of ilium, ischium and pubis form the true pelvis or laser pelvis. Now the margin of obturator foramen and pelvic surface of ischium, here the obturator internus muscle is originated. Now the ramus of ischium starts from the lower part of the body, runs upward and medially and continuous with the inferior ramus of pubis. This is the inferior ramus of pubis. This is the conjoint ischiopubic ramus. It has upper border, lower border, outer surface and inner surface. and the lower border of conjoint ischiopubic ramus form the subpubic angle, part of subpubic angle, and in male this is everted. That the attachment is crus of the penis. The outer surface of conjoint ischiopubic ramus is concave. Here the attachment of foremuscle upward to downward, obturator externus, adductor magnus, adductor brevis, and gracilis. In the inner surface there are two faint ridges. This is the one ridge and this is another ridge, and it forms three divisions: upper, medial, and lower. This is the pelvic surface of ischium, and this surface is crossed by ureter. That's all about ischium.